we'll be continuing the blood supply of the heart. In that we have seen the arterial supply. Now we'll be seeing the venous drainage. This is basically drained by three things: coronary sinus, which drains into your right atrium in between the opening of inferior vena cava and the atrioventricular orifice. Then you have anterior cardiac veins which directly drain into the right atrium and chamber, right atrial chamber. Then you're having the venae cordis minima. So you need to go through the book. What is the other name of this venae cordis minima? Venae cordis minima are the minute veins which directly drain into all the chambers of the heart. Directly they drain the venous blood into that. Now getting back to this coronary sinus. Coronary sinus is a large vein which you will be finding in the posterior part of your atrioventricular orifice, that is in between your right atrium, left atrium and right ventricle and the left ventricle. For that you can see the posterior part of your heart, that is, this will be your pulmonary veins draining into your left atrium, and this is your two superior inferior vena cava draining into your left atrium. And this below this we have this in between interventricular septum. This is interventricular groove, this is atrioventricular groove, and this is interatrial. So this point where all the four are meeting, this we are calling it as the crux. Now coming back to your venous drainage of the heart, we need to see this coronary sinus. So this will be present in the posterior part of your atrioventricular groove. So it will be having different veins draining into that. So what are the major veins draining into that? One thing is, you can see in the other diagram. So how to draw your heart? This is a superior vena cava, right border, inferior border, right auricle, pulmonary trunk, left auricle and left border of the heart. So here you have anterior part of AV groove. This will be your anterior interventricular groove. So now coming back to this venous drainage. So we have this coronary sinus which will be starting in the posterior part of your heart. From the left border it's going towards the crux, and after that it will be draining into your right atrium. Right atrium. This is your left atrium, right ventricle, left ventricle. This is, if you are seeing from the posterior, this will be a diaphragmatic surface, this will be the base of the heart, this is the sternocostal surface. Now coming to this. So you have major things. One is your great cardiac vein, which will be going along your anterior part of your interventricular septum. This is great cardiac vein. So here we had a left marginal artery. Same way you have a left marginal vein which will be draining into the great cardiac vein or directly into your coronary. These in turn they will be draining into your coronary sinus. This is left marginal vein. Same way, if you see the posterior part, this is your posterior interventricular groove. In this we have one more vein called middle cardiac vein. Apart from that, you have one more thing. Here we had an artery called right marginal artery. So with the same name you are having the right marginal vein. This drains into a vein called small cardiac vein, which continues along this inferior border and posterior part of your atrioventricular groove, which is on the right side, and at last it will be draining into your coronary sinus. So this is your small cardiac vein. Apart from that, you have one more vein called left posterior ventricular vein, and this is oblique vein of left atrium. So these are your tributaries which are going into the coronary sinus, and this coronary sinus at last it will be draining into right atrium. So what are the major tributaries for that great cardiac vein, which is going along your anterior interventricular septum, then left marginal vein, which either drains into the great cardiac vein or to the left end of your coronary sinus. Then you are having middle cardiac vein, which is along the posterior part of interventricular septum. Then small cardiac vein, which is draining into the right side of the coronary sinus, which in turn is drained by right marginal vein. Then apart from that, you have one more thing, left posterior ventricular vein, which is coming from the ventricle, and the oblique vein of the left atrium, which is coming from the left atrium. So these is along with that, as I said before, you are having anterior cardiac veins and venae cordis minima. So that is your venous drainage. Then applied aspect of all this arterial supply is, if there is an occlusion in any of the arteries supplying the heart, then like atherosclerosis or any thrombus formation, then you are having a thing called myocardial infarction. What's happening in this? Because of the plaque which is present in the vessels, that is either decreasing the blood flowing to that myocardium or completely obstructing. So for that, how to detect that? We are having angiography, through which you are sending a fiber optic wire through your vessels to see where the block is, and apart from that, they will be using a balloon. Through that, they can either decrease that, widen that occlusion, or they may use a stent in that, so that that narrowing is opened up. And apart from that, you have one more thing called bypass grafting, that is shortly called CABG. What is the CABG? Coronary artery bypass graft. So what is that? It's something like bypassing. If this is the vessel which is blocked, so this point inferior to that, this myocardium doesn't have its blood supply. So for that, they'll be using a vessel to bypass this. So this you are calling it as coronary artery bypass grafting. So what are the vessels used during this bypass grafting? One is your great saphenous vein, and apart from that, you have different vessels like internal thoracic artery and all. So winding up, what are the arteries? Major arteries supplying the heart is the right coronary artery, which is coming from your anterior cardiac sinus, or you can say here anterior aortic sinus, which is from the ascending aorta, related with your three cuffs around the ascending aorta opening. And apart from that, you have one more thing, is the left coronary artery, which is coming from your left posterior aortic sinus. So winding up, reminding all that things, basically how to draw your heart is, this is one side, it's something similar to your triangle, inferior border, then right auricle, then draw a pulmonary trunk related with that left auricle, then left border of the heart. Then here you have atrioventricular groove. This will be anterior interventricular groove. So whereas this anastomosing between the right coronary artery and left coronary artery occurring branches of that. One thing is related with the apex of the heart, where this anterior descending branch from your left coronary artery is anastomosing with the posterior interventricular branch of your right coronary artery. And apart from that, the major thing is near the left side of the crux, where you have this anastomosis between the your circumflex branch of left coronary artery and right coronary artery. So this is other diagram showing your posterior surface and the diaphragmatic. So now coming back to the arteries. What was that? This is our right coronary artery going down. So from the branches from that, one is your right marginal artery, then you have right conus artery, then you have one artery going to the SA node, then this comes back into the posterior part of your atrioventricular groove and goes somewhat right of the crux, and here it's anastomosing with the circumflex branch of left coronary artery. Here you have a posterior interventricular branch, or you can say artery. From this you have septal branches. One of the septal branches going to the AV node. That is a major thing. Then apart from that, this is right conus artery. Then from the left coronary artery, it's coming between the pulmonary trunk and your left auricle. From there, it's giving one thing is the circumflex branch, and one more thing is the anterior descending branch, which goes till the apex, and from there it will be anastomosing with the posterior interventricular artery. So this is your anterior descending branch or anterior interventricular branch. So this is shortly called LAD. This is the naming used for during angiogram. So this is an artery which is predominantly blocked during your myocardial infarction. Then from this you have one branch called diagonal artery, and this is your circumflex branch of your left coronary artery. So from the circumflex branch you will be having one more branch called left marginal artery. This circumflex goes behind anastomosis with this. So from this you have some ventricular branch, some atrial branches. So here you can see, whereas anastomosing here at this point, where with this anterior interventricular artery is anastomosing with the posterior interventricular artery, and here one more point to the left of the crux, where you're having this posterior interventricular artery, or you can say right coronary artery. That is not the posterior. Right coronary artery is anastomosing with the circumflex branch of the left coronary artery, and here sometimes you have one more anastomosis between this. This is your left conus artery, which is a branch of your left coronary artery, which will be supplying the infundibulum of your pulmonary trunk. Then what about the venous drainage? Accompanying this you have something. So here you have great cardiac vein, right marginal vein. This goes with the small cardiac vein. In this you have this middle cardiac vein. Here you have coronary sinus. So here is one more thing is that is posterior vein of the left ventricle, oblique vein of the left ventricle, and one more thing here. So getting into this, you have one more thing, that is right marginal vein. At last this goes into the coronary sinus. Thank you.